This hand-drawn sketch of the House of Healthcare right behind me, it's more than a sketch. It's just a roadmap for protecting your retirement. Many retirees in their 70s and 80s look back with real regret, wishing they had addressed key health costs earlier. Things like dental, prescriptions, home care, and even extended care expenses, and all those gaps in Medicare. Those are the cracks that can quietly drain your savings. So as we walk through this House of Healthcare together, take good notes. What you do today could help you avoid future regrets and build a stronger, more secure retirement for the decades ahead. So welcome to the House of Healthcare, where we have our healthcare plan in retirement, and we are looking to build our house so that we enjoy retirement. And our retirement House of Healthcare plan has a lot of building blocks to it. Let's go over a few of the building blocks. The first building block we have sitting here is our Medicare Part A. And Medicare Part A is our hospitalization component of Medicare, where we do have a deductible every time we go into the hospital and are admitted. That is a per stay deductible, and it also will take care of what we call skilled care up to the limitations that Medicare has. Okay. The next building block that we have is what we call Medicare Part B. And Medicare Part B is everything in the outpatient setting. And in the outpatient setting, this is taking care of doctors, it's taking care of therapies, taking care of testings, and it's taking care of treatments as well. Your outpatient surgeries, all of that is part of your Medicare Part. And this will always have Medicare will assess you an annual deductible of it's over $200, approaching $300 once a year. And then you are also responsible for 20% of the bill in an outpatient setting. Lastly, we have Medicare Part D as in dog. Medicare Part D, this is your prescription plan. And this is something that is a voluntary plan to get when you turn 65 or when you leave an employer coverage. But it's highly recommended to get a prescription plan, even though there's a lot of them that are zero premium plans, and it takes care of issues further down the road. These are best to review on an annual basis, anywhere from October 15th through December 7th. They should be reviewed annually on that building block. Over here on the other side of the house, every house has to have a balance thing. We would have over here a Medicare Supplement plan. Okay, Medicare Supplement plan are offered by insurance companies, and these are plans that will fill in the gaps. In fact, these are also called Medigap plans. Okay, Medigap plans, and so they're fill those gaps. They're going to pay for that 20% expense that you see over there, and they're going to allow you to go to any doctor, any hospital, anywhere. Very important to have that ability to go anywhere for those treatments, testings, cancer treatments, whatever it is. And then lastly, these are what we call annual renewables, so that there's no worries about having to renew. Annual renewable, they just keep on going year after year. They do need to be checked from time to time, but Medicare supplements are very solid, taking care of the care, as we call it, skilled care. This is all has to do with skilled care. All right. Lastly, up here we have this is dental plan, dental vision and hearing. Dental vision and hearing. It's very important to have dental health in retirement, and so a good dental vision hearing plan can help that all the way through. It's a very effective part of the plan, overall plan of our House of Healthcare. Now, some people may have an interest if they have cancer in the family. They may want a desire to have some kind of cancer policy in here as well. And so some people may want to build their plan up to have a cancer policy, or possibly there's times when maybe a hospital indemnity plan may come into play as well. Now, what makes up the foundation? What makes up the foundation of the house is what we call down here. This is called custodial care. Custodial care is the foundation of the plan. Custodial care. And these are expenses that are left for you to pay. And so this is better known as long-term care expenses, or short-term care expenses. These are known as custodial care. Be it known that Medicare above it does not cover custodial care. Your Medigap plan does not cover custodial care. Custodial care is noted as care that's needed at home or a facility, and it's requiring the fact that you need help with 2 out of 6 called ADLs: eating, dressing, bathing, continence, transferring, toilet. Okay? And so this is the foundation of the house, because if someone doesn't have a custodial care plan in place, then this is going to drain. It is doing this right now. It is going to drain our savings accounts to pay for this type of care, and everything starts to crumble from there. So savings accounts are going to be at risk if we don't have a custodial care plan in place, and there are affordable ways to do that. And lastly, but not least, is a small little subflooring of the foundation as well, called what we call final care. And that is what happens when you pass. What is the option? You leave it to the family to pick a tab for all the expenses, and the expenses keep going up. Having a little final care plan is a nice thing to have along the way for the family to immediately get things going. Okay, so that wraps up our house of healthcare. That has many components to it. It should be evaluated from time to time, certainly every year. Perhaps in this scheme of things, where everything is being evaluated step by step along the way, because if you watch the research, the expenses are going to be increasing as time goes on. So this is our house of healthcare. Tidy it up, put the blocks in place, and make sure we put it and make it affordable.
As we wrap up this walk through the house of healthcare, here's one of the most important takeaways I can leave you with after many years of experience. There's a big difference between skilled care and custodial care. Skilled care is a short-term medically necessary care like a hospital stay or rehab after surgery, and Medicare helps cover most of that. But custodial care, also known as extended care, is when you need help with daily living, bathing, dressing, meals, or just staying safe at home. And that's on you. That's on your retirement savings. That's on your family. Medicare doesn't cover it. And many retirees don't realize this until it's too late. That's when regrets show up, families scramble, savings get drained, and options really shrink at that point. But here's the good news. A smart healthcare plan in retirement can be affordable if you understand how it's built. That's why this house of healthcare matters. When you lay the right foundation and fill the gaps before they become a crisis, you're in control. So let's take the next step. Let's talk. I'd love to help you enhance the notes you've taken and show what's possible with your plan. Together, we can build a strategy that brings security, confidence, and clarity for the next 35 years of your retirement, and we can do it affordably. We'll talk to you soon.